Yeah, we tend to think of athletes as being healthy people. They're out running or lifting weights or wrestling or whatever they do. But surprisingly, there are a number of conditions that are more prone to develop in athletes, depending upon what kind of sport they engage in. One of the reasons is they may be in an environment where they're very close to other people that may be carrying a bacterium, for example, like staph, so they're prone to get boils and sometimes cellulitis and folliculitis. So that's one thing that can happen. There's also sometimes herpes virus infections, especially in wrestlers. There's a type of herpes called herpes gladiatorum, which is due to their touching one another in a wrestling match, and one spreads the herpes to another one. Fungal infections too. They get hot, sweaty. The skin, especially in runners or people that are in hot, warm environments, the skin chafes, and then fungus can set up shop there. They can get a yeast infection or can get the so-called jock itch, which is due to ringworm type of fungi. So those are all things that we see fairly commonly in athletes. Yeah, athletes can protect themselves if they use careful skin hygiene. So in other words, for wrestlers, for example, they need to make sure that they use a good antibacterial type of wash very frequently, especially after they've wrestled and ideally before they wrestle. So if the wrestlers are all doing this together and they're keeping the gym clean and all this kind of stuff, the chance of spreading those kind of infections is certainly less. As far as trying to prevent things like ringworm, it's good when you're getting hot and sweaty, you want to let that area kind of cool down, take a cool shower, let the area air dry so that it doesn't really just stay hot and macerated and whatnot. You think you might have one of these infections, athlete's foot or jock itch or whatever, probably the first thing you can do is maybe just try something over the counter. There are things like antifungal preparations that you can buy at the pharmacy. If it's not getting better within about a week or so, probably ought to call it to the attention of your dermatologist, have them take a look at it. They can do a scraping or possibly even a skin biopsy. Even though in a young individual that's got the predisposing factors, that's going to be by far the most common cause. There are some other things sometimes that can look like fungal infections that are more serious. So you wouldn't want to let it go too long if it didn't respond pretty quickly to treatment.